Hi, everyone. Good day to you and good day to Georgie Matthew, the owner of the Nurses International, one of the owners, and to Anjali Giyang as well, our successful NCLEX-Australia Passer and OSCE Passer. And now she is already currently working as a nurse in Canberra Hospital. So we are going to discover how she was able to successfully achieve all of this with the assistance of IPASS and as well as the assistance of Nurses International, especially on her OSCE. So Georgie, would you like to introduce yourself to the public?
Hi, good day, guys. My name is Georgie. I represent NI, Nurse Assistant International here. We are pioneers in OSCE preparation review in Australia, and we've been in business from the time APRA decided to go the outcome-based assessment pathway. So that's in 2020. We are really proud to have almost around 97 to 98% passes in each exam when it comes to OSCE. And I'm humbled sitting here looking at one of our ex-students who's done really great for herself. She managed to pass her NCLEX from Philippines. Being an offshore candidate, she signed up with us and did her preparation, came over to Australia, attended the face-to-face, gave the OSCE, and became a registered nurse. On top of that, she's managed to secure a job as a registered nurse in one of the toughest hospitals in the country, that is the Canberra Hospital. So that is an achievement in itself. Hats off to you, and congratulations both to Rachel and for Anjali for shaping up her career.
Thank you so much as well, Georgie. Without the assistance of Nurses International, this wouldn't be possible because I know that OSCE preparation is really a tough one. It's really a nerve-wracking procedure
It
that they
is.
have to go through. But with the assistance of NAI, with the collaboration of IPASS as well on her first step, everything was achieved by Nurse Angeli. So I'd like to introduce myself as well. I'm Rachel. I'm one of the founders of IPASS Processing. We assist nurses and other medical professionals on their international exam application. So the assistance that we provided to Nurse Angeli was for her NCLEX-Australia application. And were you able to go through or were you able to enroll for the review program of IPASS Online Review and Mentoring Academy, Nurse Angeli, or you did it on your own?
I did everything with IPASS.
Oh, okay. The NCLEX application and as well as the NCLEX online review program. So we want to share the success story of Nurse Angeli for us to be able to inspire you guys, especially because we know that there's a lot of struggle that you're going to encounter, a lot of procedures that you are going to go through. So this is for us to motivate you that with dedication and commitment, you can really achieve your goal. So Nurse Angeli, would you like to introduce yourself to our audience?
Hi, I'm Anjali Giyang, and I'm a registered nurse in the Philippines and now an Australian registered nurse. So I started my application with the IPASS Academy. Everything that I've done is by their help from the start of the application through my NCLEX review and until I got my application, my AFRA registration. So I met Nurse Assist International through IPASS. And I did the online classes with them when I was in the Philippines because right now I'm in Canberra. And I reviewed for 3 weeks. I practiced for 3 weeks in their laboratory. So we have access 24/7 in that laboratory in Sydney. We have a face-to-face. I did that in Melbourne for 5 days. And then 1 week before my exam, I just practiced on my own, but with the step-by-step process that was taught by the instructor of the NAI, Preeti Ma'am, Rina Ma'am, Jita Ma'am. We also have the assessment, which is the mock exam, wherein we have the stations that they will give us scenarios and everything, and they will give us the feedback. And that day, Preeti is one of my assessors and was telling me, Anjali, why are you so anxious? And I was like, Mom, I was not ready. I'm not ready for this. And I was like, no, you can do it. And one of the assessors told me like, you are good like this and like that. So it's very important to take the criticisms positively because it will mold you and make you positive for the exam. Because that 3 weeks, like I'm myself, but I know that NAI taught us everything that we need during the exam. and we only have how many minutes to do the scenario and the one set. So it's very hard what to do, but every process is properly, from introducing yourself. Like I watched George's video, like, yeah, this is right. Introduce yourself, wash your hands. So you need to start from the three major parts of the step-by-step process. So I start going to the lab at 8 a.m., end up at around 5 p.m. So I really studied a lot and practiced a lot for 3 weeks. So the assessment helped me a lot for that thing. And so for all the ones who is trying or wants to review, you just need to more effort and practice in the lab for as long as you can, and before the exam will happen. So NAI also provided me with the handbook, and the Moodle is very helpful as well, because everything is there. Especially Australia is very different with Philippines, the standards and everything. So I need to learn a lot. I need to read everything, the resources that was given there. Everything is in the Moodle, not only the videos that there are, but also the other resources that we need, the forms, the New South Wales forms, that I also tried to read everything for me to have more knowledge about the Australian standards. So I believe NAI is the best when it comes with the OSCE preparation. And I'm one of the ones who was able to pass OSCE just because of them. I'm from the Philippines and went here just for the review. And I was like, oh my God, can I do this? Can I make it? But then I'm just aiming for 7/10. But because of NAI's help, I did like 8/, like knowing like you are from the Philippines. I'm having a hard time communicating with the Australians, like how will I do this, like this, like that. But the support is very, very helpful for me. IPASS is there with me during the first step of this application, and then and it's very helpful as well. Everything they teach us is very productive and very helpful. They also helping with the accommodation at the moment, but because of I am the one who is like first batch coming from the Philippines. So I was like, oh my God, can I help? You can really do it. Just believe with them, believe in them, because online classes is there. You can do it before going here in Australia. And then we have the Moodle wherein you can watch anytime you want, and like practice the dummies in the lab. Everything is there, the materials is there. You can use anything you want, you can practice and review all you want in there. So it's very nice to have them during this application, during the road to Australian registered nurse.
I know, Georgie, you want to say something after you have heard everything
I will
that
say that. Thank you so much for
Andy's.
all those kind words. But one thing we should not forget, that the fundamental of nursing, the basics of nursing and the theoretical knowledge that you got before you could come for the OSCE level was from IPASS. So your foundation was set by them, and we built you on that. Most important thing when it comes to constructing somebody's career or shaping up somebody's career is to have a very strong foundation. I think the credit goes to IPASS and Rachel and team for molding you in such a way that our job was much easier. You're an absolutely amazing, hardworking student. You flew the flag of Philippines in high flying country Australia. Now, I would say kudos to the team in IPASS for making that foundation so good and making our jobs very easier. Good job, Rachel and guys.
And we couldn't do it as well, Georgie, without the assistance of Nurses is International. As to what you have heard coming from Angeli, she has a very high regard with regard to the assistance in the program that you have created for our students. It's really very challenging for us Filipinos, especially that we are not familiar with the Australian standards. So having Nurses is International guide them will really be a game changer for this one, and it will be very helpful for them, because if there is somebody who can guide them, it makes the journey even easier, in a way that the student will not be anxious anymore. How am I going to do things? What will be the first step, second step, the third step? So with the guidance of Nurse Assist International, it makes the process streamlined, and everything has been done perfectly. So thank you very much as well for the quality of work that Nurses International is putting. And I know that you have your heart, your mind in this assistance for the nurses. So thank you so much, Georgie, and to Preeti, and to everyone
Thank
in
you.
Nurses International. So, Nurse Angeli, I'd like to ask some questions. So, you were able to have the program or attend the classes of Nurses International even before coming to Australia, right?
Yes, ma'am. I did online classes with them
Mm-hmm.
before coming to Australia.
Can we tell our audience in details, like how long is a student allowed to access the program for those who are outside of the Philippines, and how long can they access the program if they are already in Australia? So what did you do?
For me, I think that's unlimited review for Nurse Assist International for a year. So I enrolled with them since January 2022 or 2021. So since the border here in Australia is still closed, so I wasn't able to pursue the when I get the schedule for the exam, that's when I started to review the online before coming here in Australia.
So, Georgie, that would be an advantage to your students, right? Because they can just use your program even though they are still outside of the Philippines. Can you elaborate more about your program that you offer,
Yeah,
Georgie?
so we our resources are open to our students who enroll with us from the day of their enrollment. So they have unlimited access to all the resources, all the video recordings, all the OSCE related stuff that they need for their preparation. So even before the students Australia from their home countries, from the comfort of their home, they can attend the online classes how many ever times they want. Say, for example, someone was not able to travel to Australia for their OSCE or they didn't get dates. We are more than happy for them to attend another set of online classes with us. So we don't stop our students from face-to-face sessions or how many ever online classes are as much as they want. And everything is given to them once and for all, and we don't take access of them. So that is kind of a value add to being a student of Nurse Assist International.
That's great, really, because they can access it in a limited access. So, Nurse Angeli, with regard also to the usage of the lab, may I know first, coming from Georgie, how many labs do you have in total?
So we have our simulation labs in Sydney, Melbourne, Brisbane, and Adelaide.
Mm-hmm.
So we let our students access the convenience. So
Lab.
which actually means that I do not hold the keys to the lab. The keys to the lab are with our students. So I don't have anything to do with it. They open the lab, they go in, they practice, they keep the keys with them. So when they're done with their practice on the last day of OSCE, I'll get a text message saying that, thank you so much, sir. I have left the keys in the top drawer. The keys are for the next batch. So literally, we are a company run by our students. We perform everything based on the feedback that our students give us.
That's really excellent. Thank you so much for that, Georgie. That they have the total control of the lab that you have. And
Yes, they do.
how many times were you able to go to the lab of NAI? And what can you say about it?
I did the face-to-face in Melbourne, ma'am, for 5 days. So we have a lab there. And then 3 weeks in Sydney. Yeah, and sometimes I did open the lab because I was so early. So I start early practicing in the lab. So I have the keys in the morning and then we just close it whenever because there's another students who practice in the lab until around 8 p.m. I think. Yeah, and then before the exam in Adelaide, I also went to their lab in there. So it's very accessible. I went to Melbourne, Sydney, and Adelaide lab. So it's very all the materials is there.
That's great to know that they have a lot of labs because wherever your location is, you can go to their labs and practice the needed procedures that you need to practice on. And with regard to the practice, Nurse Angeli, I know that this is very essential because you're going to do the procedure on a practical way, right? So, what can you advise to those future OSCE examinees? What can you share to them? Like, how often should they practice? How long should be the duration? What are your insights on this?
For the 3 weeks that I did my practice, so in the morning, we always do CPR. So for our cardio in the morning, so CPR every day for 3 weeks, and then all the steps like that we need the dummies like CPR, IV, IM meds. We do everything in the lab, and in the afternoon, if we have time, that's the time we do reviews, MSE, wound, like this and like that.
As to the duration, so it depends on the individual applicant, like how long they want to practice. Do you mean to say like that? It depends on their
Yes,
availability.
ma'am, because sometimes if there's three of us, like a group, first one will be the patient, then I will be the assessor,
Mm.
then the other one will be the nurse, and then if we are four, then we need a second nurse before, because here in Australia we need seconds like S8 medications and for pediatric patients.
Mm.
So we need a group like
Mm.
3 to 4 persons to do the scenarios.
And it's because Nurses International has a lot of students currently, Georgie, so they can like formulate groups and they can discuss, right?
Yeah, so what happens is once we are done with face to face, we kind of make them into groups. So there'll be 4 to 5 members in a group. Like Angeli said, you need actually 4 members to perform a procedure. One will be the assessor, one will be the patient, one will be the nurse, and one will be the second nurse. So 4 to 5 students per group, and they will stick to their practice. So they're like a family. All right. So they criticize each other, they give constructive feedbacks, they practice together. I've had students who would go to a shopping mall and sit there in a coffee shop practicing forms in Melbourne. And when it comes to Adelaide Lab, I've had students who literally, they come to practice at 9 in the evening and go home at 7. So when you're coming in at 7 for practice, they'll hand you the keys and say, "Good night, I'm out of here." So it suits each other's needs. Like some students perform well when they practice on their own. Some students need that company. Some students perform better when there's not many people there. So yeah, so it depends. It varies from person to person how you want to study. Some people need to write things down. Some people just have to look at things. Some people have to practice. So it depends. I've had students practicing even now before we started our online is so even before face-to-face session, there are students going to our labs and practicing. So if you need that extra mile, extra push, we are more than happy to do that. But if you take the Adelaide students, they all come from overseas. They come from Middle East. They're practicing nurses. So they do not need that much of a time. So they come in for like 3 weeks, 1 week of face-to-face, another week for their mock assessment, and then they're good to give the OSCE. But if you have a student in, say, Sydney or Melbourne, they would need more time because they're not working as nurses when they're in Australia. So they need that extra time to, dust everything off and come back to that nurse's hat and start doing things like the way nurses would do on the student and their capacity. And we cater to all sort of students. We kind of support them wherever they need. So it's that equity thing. Some people need a little bit more push than the others. We're happy to do that. And some people just need that pat on the back and they're fine with it. So Anjali was right. So that is how it works.
Yeah, I agree on that, Georgie. Actually, it really varies from one student to another. It depends on what was their experience prior to having the OSCE preparation. But definitely, the assistance of Nurses is International is very essential for them to be able to pass this OSCE examination. You mentioned earlier regarding the mock examination. So, what was your feedback about it, Nurse Angeli, the one that was provided by NIE?
One of the feedback, so we have 3 assessors. So with Preeti, I was very anxious. I don't know if I passed with that procedure, but she is very positive to this, and you still have time to practice. And then that's wound dressing, I think, with Preeti. And then with my vital signs, with another Filipino assessor, she told me that I did great with that procedure. And then the IV medication, I didn't finish that procedure, but according to the assessor, I did great as well with the. So I did like 8 or 9, but it should be 10, but I don't have time that day. So there's a 10 mock exam for us.
Georgie, would you like to elaborate more on the mock examination that you can provide to the students?
Yeah, so the mock exam is the closest thing that you are going to see to OSCE before you actually give your exam. So we managed to give 9 to 10 stations per student. So they'll be given similar to OSCE questions. They'll have 2 minutes to read the scenario, 8 minutes to demonstrate it, just like the way they would do it OSCE. So they will have actors, which are us in this case, and they will have dummies or any other article that they need. They would gather them and come and perform the procedure. And we time them for 6 minutes and 8 minutes. So 6 minutes, the timer goes off, and then 8 minutes, another timer goes off, just like in your OSCE. And we make sure that we provide one-to-one feedback after each procedure. Now, the positive thing about that is you have done your face-to-face, you've done your practice, and you're giving your mock assessment. This is where you kind of sharpen your skills and polish everything that you've learned so that you're presentable in front of the OSCE examiner. So most of the students gain a lot from those personal feedbacks where they probably are practicing something wrong or they're going wrong here or there. So when we tell them that this is where you're going wrong, from the very next day when they practice, they incorporate those feedbacks into their practice and they make it absolutely wonderful. So it's a very positive thing. And it takes a lot of effort from our side to be there doing this mock assessment. But I think it's a value add. It helps the students a lot.
So like it's a simulation of the examination, right? The actual examination.
Absolutely.
So Nurse
Yeah.
Angie, with the mock assessment that you had with Nurses International, can you say that you really had the confidence, like 100 confidence that I'm going to make it because I already did it in I.
During the math exam, I'm not confident with myself,
Mm-hmm.
but with the NAI that they did everything like because with the face to face, they taught us already what do you need to do. So
Mm-hmm.
what are the step by step process? So what I did is I have a compilation of what are the procedure
Mm.
that I need to do. So I stick with that, and then that made me pass the OSCE exam.
So we can really credit your passing of the OSCE with Nurses International. And that's really very fulfilling for
Yeah.
Georgie and Preeti and
Yes.
everyone in Nurses International.
Absolutely is.
It's a great job,
Thank you.
Nai. So
Thank
with
you.
regard to I'd like to touch on the materials that you also had. It's interesting to know that we're using the Moodle for the IPASS Online Review and Mentoring Academy. You are also using the Moodle, Nurse Angeli, with Nai. So I think it wasn't a difficult transition for the NCLEX preparation and as well as what you're using for the OSCE, right?
Yes, ma'am. I did the model in IPASS and after that to NAI as well.
That's
So it's
great.
very helpful.
Yeah, okay. That's really great to know that it wasn't a difficult transition for you from the time that you had your NCLEX preparation and up to the part for the OSCE preparation. So thank you so much, Nurse Angeli, for sharing what Nurses International have done for you with regard to your preparation. And I know that you are already currently working as a nurse now in Canberra Hospital, and as what was mentioned by Georgie, it's a difficult institution to join with because they have a stringent procedure when it comes to hiring. So it was
Yeah.
very fulfilling to know as well that you're able to make it on the hiring procedure. So what are your tips that you can provide probably to those who are still aspiring on applying for an employment in Canberra Hospital or even to other facilities in Australia?
For me, ma'am, it's really do not rush everything because if it's your time, it will come into places. Like my sister always tells me that do not rush. You will find a job, and if it's for you, it's for you. Because I've been here since last year, and knowing that I'm from the Philippines, I'm here in an international country, it's very hard. And I think it's with the foundation that I did with the IPASS and NAI. Because they interviewed me for this work. Actually, I was interviewed for emergency department and PEDS department. I was hired by both, but I just choose PEDS because at least I have experience back home. So for the one who is trying, just pursue your goal, pursue your dreams, and don't rush things. Because if it's for you, God will provide. That's what I always think, and that do not rush, because if you rush you will end up like in the far places, like you will end up and having a contract with too long, and you will not be happy. And that's why I was like, if it's for me, then this is for me, then they gave it to me, then that's it. I'm very thankful to my IPASS family since day one, and AI family from the start. Step one until I got my registration, it's all from IPASS. The first step and until the registration, IPASS helped me, and then that's why IPASS introduced me to NAI for my OSCE review. That is very helpful because I almost enrolled to another review center with other offers, but then I stick to IPASS, and no, I need to stick with NAI as well because they are partners. So that helped me a lot.
You know, we can really vouch the quality of education that Nurse Assist International is providing. That's why we have a strong partnership with Nurse Assist International, because we know that when we hand over our students to them, when we endorse our students to them, they're going to take good care of our students. That's why we trust them wholeheartedly as well, because they have a very good feedback coming from the students who already made it on their OSCE. So Nurse Angeli, thank you so much with the sharing that you have provided, with the insights that you have provided, and with the motivation that you have shared to our audience. This just proves that with the dedication, with hard work, with commitment and faith, that you can really make it, and with God's grace as well, everything can be possible. Georgie, would you like to add something to say to
Yes,
Nurse Angeli?
thank you so much for coming and talking about your experience with us, Angeli. I would like to thank you for trusting us for your journey to make it as an RN in Australia. It's not a small feat, it's an amazing thing for someone from a different country to come over here and do it. Now, at nurses is we all are international nurses. Okay, so we were all in your shoes one point of time. So we all know and feel how you're feeling when you're coming here for the exam, when you are going to face a strange set of people in a strange enough country, in strange environments. So we understand that our students are not at ease. It's our responsibility to make them feel at ease, make them feel welcomed, make them feel supported. Now, IPASS and NAI has been working together for a couple of years now, if I'm not wrong. The ideology that we both base and the values that we respect in our profession, that is the main thing that holds us together as a team. When they endorse a student to us, we make sure that the name that they are bringing forth, IPASS from Philippines, is taken care of, and we provide our best so that they have the same reputation back at home with the student. So we do not have a student who goes back to Philippines and say, "Oh my God, what did you guys do with me? You guys send us to an institute which didn't take care of me." No, we believe that you guys are family, and we always take care of you like family. Family are those people who are there for you when you are at your lowest lows and when you're at your highest highs. So we still keep in touch with all our students. I'm very proud about it. And I can see that you guys do the same thing, Rachel. So it's not just you come, do your OSCE, get your registration, and you walk out of here. We still keep in touch. So it's like family. I've had so many students messaging me today saying that, sir, this, sir, that, and I got my registration. I'm so grateful. It makes me feel so proud, and it kind of makes me feel very humbled. And I was able to make some difference, or we as a team were able to make a difference in somebody's life, make someone's career, make someone's future, make someone's life. There is no more blessing than that, another person telling you that you were the reason why they are at what they are. I have a word of advice before we wind up, Rachel. It is something that Angeli said earlier that kind of made me think about it. There are a lot of agencies in Australia luring students from Philippines, saying that we'll get you a contract for work even before you start your OSCE. You will have an assured place, all those things. Think about it, guys. If you think that it is too good to be true, it probably is. Like Angeli said, I have had students come back to me telling me about the contract they have signed, which made them work in really remote places where the internet is like very shabby, where you cannot even attend your online classes properly. You sign up a contract, you end up working there. So that is going to take an adverse effect on your studies and preparation. You'll have to travel a lot to go for your face-to-face. Then you'll end up buying a motor vehicle which you really do not need or which you really cannot afford because you have to commute because you're in the middle of nowhere. So think, do your research, check out the reviews about the review center before you go, talk to the students who have reviewed there, because you guys are in Philippines, you're coming to a different place where you probably may not have so many people to support you, and it's a lot of money. So please, please, please be careful when it comes to choosing institutes and when it comes to choosing contracts that offer you job and everything before you do your OSCE. Please be mindful of that.
Thank you for pointing that out, Georgie. It's really very essential that in this time they have to be very careful with who to choose and what institution or agency to choose from. And that's
Yeah,
what Angeli just did, that she took her time in researching, she took her time, she's not rushing on things. And everything was done perfectly and everything was done smoothly because she didn't rush on making decisions. So thank you so much, Georgie, for your precious time. Thank you for
thank you.
advising our students, and thank you for everything that you have done in making a difference to the lives of those students that you have assisted with. So we and IPASS and I share the same values. That's why we have produced a lot of students. We have helped a lot of students be able to achieve their goals, and we are so happy to know, we're so happy to see that they have finally fulfilled their dreams and their goals, and this is for them, for the betterment of their future. And we really share their happiness and their joy in making their dreams come true. So for us who are service providers, we are so much happy. We're very glad to know and we're very grateful that we share this journey with them. And we thank God for everything, for all the blessings that they were able to achieve also. So thank you so much, Georgie, for your time.
Thank
And thank
you.
you so much,
Thank you very much.
Angeli.
Thank you. Thank you,
Thank you
Angeli.
Thank
so much. And
you.
we
Thank
wish you
you,
the best.
Georgie. Thank you, Ma'am Rachel.
Thank you. God bless everyone. Thank you for
God
your
bless you
time.
too. Thank you.